Are you a nursing student preparing for the NCLEX, or just you're new in RN program? Hi everyone, I'm Nurse Mia and the student nurse. Welcome to another study group, RN section, NurseGetsZen Med-Surg Prep series. This is part 3 from each chapter. This is part 3, NCLEX kind of practice, end of chapter, NCLEX questions. So as you know, the chapter is focusing 3 parts. This is part 3. So you can learn smarter, not so harder. Whatever you are studying for before class to get the quiz, or going to the RN NCLEX, and this playlist will be kind of your shortcut to gain confidence and clarity. Follow me through those 3 parts. This is part 3, which cover the 15 domains, almost 15 domains from medical surgical RN textbook. Will improve your ability through your scores for the NCLEX and classroom. So 15 domains, kind of see how gives you an idea. So check out the notes from the description below. Look out for the freebies and let's get started. It's time for me to share my screen, right? So see you sharing my screen.
Exam relevant topics are most directly supported by this chapter 6, geriatric implications. So we have a case study and 9 questions. Chapter 6 overview summary. The aging affects everybody body system, leading to higher vulnerability, slower recovery, and increased risk. Cardiovascular, respiratory, and neurological disease are common and often occur together. Cognitive issues like dementia, delirium, depression must be careful differentiated. Polypharmacy, which is like more than a pharmacy. A patient might have like 3, 5 pharmacies that gets medication, and sensory changes raises safety concern. Fall prevention, nutrition, and psychosocial support are critical nursing priorities. Nurses must assess ADL, IADLs, and advanced directive for holistic care. Respect for autonomy, cultural values, and financial challenges is essential. Question 1 is select all of the apply. Which of the following are risk factors for delirium in hospitalized older adults? It's urinary tract infection, sensory deprivation, polypharmacy, history of dementia, normal aging. Correct answer are, because it's more than one, urinary tract infection, sensory deprivation, polypharmacy, history of dementia. Cannot be normal aging. 2. Clinical judgment. Prioritization. An 84-year-old patient admitted with pneumonia is confused pulling the IV lines and attempting to climb out of bed. What is the priority nursing action? 1. A. Apply wrist restraints. B, turn on the television for distraction. C, assess for signs of infection or hypoxia. Request a psych consult. So, clinical judgment for 84-year-old patient. Assess for signs of infection or hypoxia. Question 3, case-based. A 70-year-old with Parkinson's disease reports new difficulties of swallowing and walking. Medlist shows 8 active medication. What should the nurse assess first? A, risk for aspiration. B, signs of depression. C, fall history. D, vision changes. Risk for aspiration. Question 4. Select all the apply, so it's more. Which interventions should the nurse implement to reduce polypharmacy risk in older adults? A, perform medication reconciliation at each visit. B, encourage use of herbal supplements. C, assess for duplicate medications. D, monitor for adverse drug reactions. E, avoid asking the patient about over-the-counter drugs. So correct answer are, so to reduce the polypharmacy risk. Perform medication reconciliation at each visit. Assess for duplicate medications, which is polypharmacy. It's quite very common. Monitor for adverse drug reactions. Question 5, ethical practice. A patient with advanced Alzheimer's disease has a living will that declines feeding tubes. The family asks the nurse to just feed him through the tube so he doesn't starve. What is the nurse's best response? A, the family has the final say. B, we will honor the patient's written wishes. C, let me check with the ethics community. D, tube feeding is harmless and temporary. A patient with advanced Alzheimer's disease has a living will that declines feeding tube. We will honor the patient's written wishes. NCLEX case study. Miss Alan Rodriguez, age 85, clinical scenario. So an 85-year-old female admitted to the medical surgical unit from home with complaints of increasing fatigue, mild shortness of breath, and reduced appetite. Her daughter reports that the patient has become weaker over the past month and had a near fall in the bathroom last week. The patient has a history of hypertension, Parkinson's disease, and osteoarthritis. She takes 8 prescription medication, including a diuretic. The nurse notes dry skin with poor trigger, mild confusion, and systolic murmur. Vital signs: blood pressure 156/62, heart rate 58, respiration 20 per minute, O2 sat is 95 at room air, temperature 97.9, weight loss 7 pounds in 3 weeks. So 80 years old, complaints of increasing fatigue, mild shortness of breath, reduced appetite, near fall bathroom, history of hypertension, Parkinson, and osteoarthritis. Takes 8 medication and diuretics. Okay. Question 1, multiple choice, physiological adaptation. What is the most likely reason for Mrs. Rodriguez bradycardia? A. AFib, B. Left ventricular hypertrophy, C. Loss of intrinsic factor, D. Reduced pacemaker cell function in the SA node. Correct answer is reduced pacemaker cell function in the SA node. Question 2, select all of the apply, safety and risk reduction. Which of the following increase Mrs. Rodriguez risk for fall? A. Parkinson's disease, use of diuretic, polypharmacy, history of type 1 diabetics, or bradycardia. Select all of the apply. So which of the following increase risk for falls? Parkinson's disease, B. Use of a diuretic, C. Polypharmacy, E. Bradycardia. In the case study, Dean mentioned about the type 1 diabetic. Question 3, case-based prioritization. Which intervention should the nurse prioritize? We highlight this. During the initial shift assessment, assess for recent bowel movements, B. Complete the Morse fall risk score, perform a skin trigger test on the forearm, D. Document all current medication. Correct answer is complete the Morse fall risk. Question 4, it's to complete a sentence using the best clinical judgment. The patient recent weight loss and poor skin trigger are signs of normal aging, failure to thrive, early dementia, or cachexia. Correct answer is failure to thrive. And this is the last question.